Good morning and good evening, fellow doctors and colleagues. For today's Dr. Sheng-Po retirement virtual webinar, we're honored to introduce Professor Shigeru Hirano as our invited speaker. Professor Shigeru Hirano completed his residency training at Tokyo University. He continued his research fellow training in Division of Head and Neck Surgery at UCLA and University of Wisconsin Medicine. He's currently the professor and chair of Department of Otolaryngology, Head and Neck Surgery, Tokyo Prefectural University of Medicine since 2016. Today, Professor Shigeru Hirano's presenting topic is regenerative treatment of vocal folds. Please give a round of applause to welcome Professor Shigeru Hirano.
It is my great pleasure and honor to have Dr. Sheng-Po retirement virtual webinar lecture. I'm Shigeru Hirano in Kyoto Prefectural University of Medicine in Japan. I'm really happy to do this, and Professor Hao is the great teacher and a leader. So I'd like to thank Professor Hao for his teaching and leading, and he also works as the representative of Asia. He is a hero of Asia. He always attend in every conference in the world, supported us and leading us. I really appreciate it. He's also a great karaoke singer. This is also the case in every conference in the world. Now, I'd like to talk about tissue engineering and regenerative medicine for the larynx. This is the breakthrough in the late 20th century. The aim of the tissue engineering is to regenerate tissue or organ using cells and scaffolds. Going back to 1995, Professor Minoru Hirano made a lecture entitled Phonosurgery Past, Present, and Future in the American Broncho-Esophagological Association Chevalier Jackson Lecture. In this lecture, he proposed 6 important problems which should be solved in the next decade or two, and 4 of them, including sulcus vocalis, vocal scar, or reconstruction after hemilaryngectomy or otolaryngectomy, are the good targets of tissue engineering. Today, I'd like to talk about the tissue engineering for the vocal fold. The target is scar, sulcus, and atrophy of the vocal mucosa. And also another target is the thyroarytenoid muscle, and this is an aging problem or paralysis problem. Vocal fold vibrates very quickly, and this vibration is supported by the sophisticated layer structure of the vocal fold lamina propria, and also hyaluronic acid is very important to support the ideal vibratory property of the vocal fold mucosa. Now, vocal scar, sulcus, and atrophy causes stiffened mucosa of the vocal fold, and the vocal fold is difficult to vibrate in such circumstances. Whole lamina propria is occupied by the thick collagen bundles. This is fibrosis. And sulcus vocalis loses the superficial lamina propria at this point. So these histological alterations control the vibration. So we have to address this physiological alteration to restore the voice in such cases. The voice is terrible. Now we have three important tools in the tissue engineering: cells, scaffold, and regulatory factors. Among them, stem cells should be the strongest tool to induce regeneration of any tissues, any organs. Indeed, MSC, mesenchymal stem cells, has received widespread attention worldwide. They are autologous, and its harvest is very easy from bone marrow or fat. They have multipotency of differentiation, and they also produce growth factors in a fine way. This is the first study in the world that examined the effect of MSC implant into the injured vocal fold in canine, and the transplantation of the MSC causes very nice regeneration of the vocal folds as compared to the sham control. We did comparative study using rat scarred vocal model in which the scarred vocal was treated by transplantation of ASC or BMSC. ASC stands for adipose-derived MSC, BM stands for bone marrow-derived MSC, and we checked what happened 1 month and 3 months. The histological examination at 1 month and 3 months shows good recovery of the handlic acid in both groups of ASC and BM-MSC as compared to the sham scarred control. There was no significant difference between the both MSCs, but we have to keep in mind that the effect is not comparable to the normal status. So there are room for development. Anyway, there has been 2 clinical trials in the world. Swedish trial uses bone marrow-derived MSC for vocal scar patients, 16 cases, and they found improvement of vibration or PTP in 62 to 75%. The improvement of VHA was 50%. There is no side effects. French trial uses adipose-derived MSC for 8 cases of vocal scar. Improvement of VHI was more than about 20%. So these results are encouraging, but we still have many or big difficulty to use stem cells for the human patients because of the more and more strict regulation in each country. Growth factor is more feasible in clinical use. They are naturally occurring protein, and they stimulate cell growth, population differentiation. In meantime, they regulate cell function in terms of extracellular matrix production, secretion of growth factors. Exogenous growth factor is believed to jumpstart healing process and to work as a trigger to change the phenotype of cell and its function. Indeed, we confirmed that if we applied parasite growth factor or basic fibroblast growth factor to the vocal fold, the gene expression of MMP and HA synthase was significantly upregulated. So when we apply these growth factors, it is expected that the collagen is dissolved by the MMP and hyaluronic acid increases by the effects of Has gene expression. This seems to be appropriate for the treatment of vocal scar and atrophy. We have commercially available basic LGF drug made in Japan. This has been used since 2001 for skin regeneration. We also found this drug stimulates growth of the vocal fold fibroblasts and increased hyaluronic acid production. We reported our experience in 100 cases of multiple atrophy and scar treated by intracorporeal injection of basic FGF. Indication of scar sulcus atrophy, and the protocol treatment is weekly 4 times injection to the vertebrals under topical anesthesia. This is a moderate scar case after final microsurgery for the right side of the cyst. The right side of the vertebral has a limited vibration and the voice is hoarse. 6 months after the FGF infection, the vocal vibrations are pretty normal and the voice is pretty normal. This is a severe case of scar after podectomy for leukoplakia. Voice is terrible and there is no vibration. 8 months after FGF. Much better vibration, much better voice. This is atrophy case, myoatrophy. 19 months after injection. Voice is much strong and steady. This is severe atrophy. 6 months post-injection. So this is a summary of 14 cases with vocal scar treated by basic FGF. Maximum inflammatory time, BHI-10 and global scale were significantly improved. It's also the case in 16 cases in the Southwest, also the case in 43 patients with atrophy. When we determine the success rates, is the rate of improvement of the BHI-10 more than 5, success rate of atrophy is 80%, mild or moderate scar is 90%. They are so nice. Severe scar and sulcus are down to 60%. It's still good, but we have to improve more for such cases. Melanocyte growth factor is strong anti-fibrotic elements. The therapeutic potential for fibrotic diseases has been confirmed using animal models, liver, lung, and kidney. And we also found it stimulates HF production from vocal fold fibroblasts. When we applied the HGF to the scarred canine vocal folds, the lamina propria is improved and hyaluronic acid is increased. So this is a very nice regenerative effect. Based on these fundamental results, we set up exploratory clinical trial of HGF for human vocal scar using GMP compatible HGF made in Japan. This is phase 1. Subjects were 18 cases. The local injection of HGF was repeated 4 times weekly. We had 3 groups depending on the dosage of the HGF. This is Mayo Scar. He is a pop singer. He has more difficulty in high-pitched singing. After 6 months, habituation is possible. VHI-10 was down to 0. This is a moderate scar, the bilateral podectomy.
그렇죠.
which is very bad with few vibration. 6 months. Right? Better voice and better vibration. Severe case was too difficult. This is Selga's case.
예.
6 months. Looks a little bit better, but the VHA10 didn't change so much. So severe scar still remains problematic. But in total, VHA10 vibratory amplitude of the vocal cords was significantly improved in 6 months. So there was no safety concern, and significant effects was observed in some parameters, and there is no dose-dependent difference. But severe scar remains problematic. PRP, platelet-rich plasma, is a cocktail of autologous growth factor, which has been applied in cosmetic surgery or orthopedic surgery. In fact, some Major League pitchers were treated by platelet-rich plasma to the elbow, and he was totally recovered, and worked very well. But there were limited data or limited evidence in otolaryngology or vocal cord. PRP is very easily harvested by only 2 centrifuges, so this is very easy applicable for human patients. But what we have to keep in mind is that the growth factors inside the PRP is always different according to the PRP lot. There are 4 lots we have examined using rats, and there are some difference in each growth factors distribution. Lot 1 shows highest HGF, but lot 3 has a pure HGF. And TGF-beta, there is not big change. PDGF varies depending on the lot. So probably we expect the effect of PRP depends on this elements inside the PRP. So we have to check what is contained in each PRP when we use it for the human patients. And now we use this lot 1 for the rat experiment. We use scarred rat vocal cords model. PRP was injected and check histology. The result shows very nice recovery of the hand acid in PRP treatment, and the scar tissues is improved by the PRP injection. So PRP can work very well when we use the right PRP. Very recently, Professor Pete Wu in New York reported their experience in 63 cases with 158 injections of PRP for scar and sulcus. And they reported good recovery of VHI-10, improvement of the vocal vibration. But she mentioned that patients with severe dysphonia were less likely to improve. The severe cases still remains problematic. Future direction for severe scar, we need to use more appropriately HGF, and in fact we are doing clinical trial phase 3 in Japan. And also we can combine growth factor and growth factor or growth factor plus stem cells. And we need to find out ideal PRP with the ideal combination of growth factors. Amniotic membrane is another tool for the new regenerative treatment tool. Talking about muscle regeneration of the vocal cords, we focus on the tension imbalance caused by unilateral vocal cord paralysis. Vocal paralysis causes atrophy of the muscle, which causes the difference of the tension of both sides of the vocal cord. Even after we applied polyplastic type 1, tension imbalance causes non-synchronized vocal vibration that causes gap during voicing, which causes hoarseness. So we have to regenerate the tissues, TA muscles, in order to improve the voice. There are several materials that can regenerate muscle and nerve. We again focused on the basic GF because they work for the hearing, angiogenesis, and cancer, but they also works for muscle and nerve regeneration. We set up a unilateral vocal paralysis model of a rat by resection of the canal nerve and applied basic LGF to the paralyzed TA muscle 4 times weekly and then check what happens. The muscle fiber of the TA muscle were recovered so nice with a thick diameter as compared to the sham control. MyoD or M coherent is the markers of regeneration of the muscle. They were significantly upregulated after the basic LGF injection. Acetylcholine receptor was also significantly upregulated. Nerve end was significantly increased by the basic LGF injection. So these results indicate basic LGF can regenerate the muscle and nerve in the paralyzed vocal fold. Based on this research, we applied TA muscle to the human case, LGF to the paralytic cases. This is post-thyroidectomy paralysis. The both vocal folds vibration doesn't synchronize. 4 times injection. The vibration are synchronized and the voice was better. This is a case of a left recurrent laryngeal paralysis treated by thyroplasty type 4. She's good in high pitch phonation, but very bad in low pitch phonation. Like this. Okay. High pitch is good. 4 times injection was done. She's good. Low pitch, high pitch, all passed. So this is the conclusion. There have been a lot of development and improvement in regenerative medicine of the vocal, and there are some clinical trials or clinical application for scar cell growth atrophy as well as paralysis of paralysis using MSC and growth factors. We need further improvement to overcome severe diseases of the vocal using innovative strategies. So thank you very much, and also congratulations for the completion of the works of Professor Al. Thank you very much.
Thank you, Professor Shigeru Hirano's very fascinating talk about the regenerative treatment in larynx. Now we open to the floor for some discussions.
Is there any question or comments from the participants? I think Professor Hirano, he came from a well-recognized Hirano family, and so thank you, Shigeru, for your wonderful lecture. And especially you start with your own father, Professor Hirano, which is the a giant in the laryngology, and to develop to allow us to look into the details of the vocal cord layers and the function, and which is the basics to the modern laryngology. And I also admire Professor Hirano, Shigeru Hirano, for your wonderful lecture. And especially you move up, the new regenerative medicine to a new model, and using all kinds of the tissue engineering, including the all kinds of growth factors, including the recently very hot topic of using the PRP. PRP has been used in several different fields now, and we actually try to propose a international symposium last year or the year before last year in the American Academy, and Jerry Lee, who cannot be here today, feel very sorry for that. Jerry Lee, the laryngologist in our department, would also talk about the using the PRP in the regenerative medicine for laryngology. I think we have several laryngologists in our in here, and I would like to call upon Xixi Wang, who is also a very famous laryngologist in Taiwan, and of course internationally, to give us also some comments. Wang Zhongqi, Xixi, are you online now?
Yes, I'm here. Sorry, because I'm going to the morning meeting. But thank you to Professor Hirano for a very nice talk. And I think the regenerative medicine is the future of treating some devastating voice disorders, such as sulcus vocalis or vocal fold scar. But I would like to know, according to your speech, what is the best treatment option so far to use in those disorders? And some other phonosurgeon also use other methods. For example, the Professor Choi in Korea, he also used pulsed laser to treat the sulcus vocalis, and reported a very wonderful outcome. So what's your comment on that issue? And I'm very grateful for the comment of Professor Hirano. Thank you.
Xixi, Professor Hirano could be with us today. So I guess you have to answer your question
by myself?
By your own. So please, just comments and no, and but I guess maybe I could just briefly mention. I think the all kinds of growth factor, you see, some of them have completed the clinical trial, and actually some of the products, including the I think it's fibroblast growth factor, has been in the market. Especially in Japan, and I don't know if we could have that in Taiwan. I think we have to check for that. Anyway, it has been completed, the phase 3 trial, and come into the market. And I guess that's the only one, growth factor in clinical practice. In commercialized available clinical practice product, and some others like hepatic growth factor has been still in clinical trial and not completed yet. And now I think the hot topic will be the using PRP, which contains many growth factors. So it's a mix-up of growth factors in the PRP, and so there are a bunch of results reported in the articles in the in the journals that PRP has some promising and results, but in comparison with others, well, actually, I don't really look into all the details. Maybe you have the answer for us, CC Wang.
Yeah. Thank you for your comment, but I don't have any answer to this issue. So hopefully we can get the hepatocyte growth factor to use in the future in Taiwan. And right now, the only thing we can try probably is PRP. But I would like to raise the attention that all the foreign surgeons should be very carefully to inject any material into the ranked space, because when we do surgery to the vocal fold, we can probably improve the voice, but we can also cause the ranked space inflammation and worse the voice. So we should be very careful before doing any procedure to the vocal fold. So the consultation, a good consultation with the patient is the best policy, I think. Thank you, Professor Ho, and congratulations to your retirement.
Is there any other more comments? And thank you, CC, for your comments. And I think Professor Hirano today really give us a cutting edge, lecture on the regenerative medicine. And I think he is the one of the pioneers in laryngology today. But I know he is not only doing laryngology now, and he is the current president of the Japan Head and Neck Society. So he is also doing head and neck, and also he very much involved in the IFOS as well as Asia Oceania, and so he is going to host the next Asia Oceania meeting, I think in 2027 in Kyoto, 2027 in Kyoto. And so congratulate to Professor Hirano for such a wonderful lecture. And of course, thank you for all the participants. So just give you some introduction of the some of the next meeting. Could we see the slides now? Yeah, so the next week will be our friends from United States, University of Southern California, the Professor Uttam Sinha. He will talk about the AI, and then we have another chance in our fields, Pankish Chaturvedi, and from India, and then the last in this month will be Professor Kopishi from Malaysia, and her topic will be will be cochlear implants. Yeah, so look forward to hearing all these stars in our field to give us lectures, and of course also look forward to your continuous support and logging in every in the webinar in every Monday morning this month. So thank you again for Professor Hirano, and thank you, Peter, for your introduction and moderating, and thanks to all the participants, and hope you have a very good day. Thank you. Bye-bye.
那属性上，它在鼓膜上留置的时间其实是比较长，要把这个每个 EQ 它在鼓膜上停留时间跟它的 geometry 就是它的